Hello, my name is Isis Swain and I'm the co-founder and COO of Greens Health. During COVID, my father was diagnosed with type 2 diabetes. It was the scariest part in our lives, and we learned that many people who had chronic conditions were unlikely to survive. We took my father's diagnosis very seriously and attended every doctor's visit. But there was one visit that stuck out to me. It was with his nutritionist, who told my 65-year-old Black father from a small town in Mississippi to stop eating meat and start eating kale. My father looked at me and my husband like, what the hell is kale? But you have to understand, for the last 10 generations, my family has grown collard and mustard greens on their farm in Mississippi. And those are the greens that they prefer. The one thing I wish the nutritionist would have asked is, what are his food preferences? What did he like to cook? And most importantly, what does his environment look like? To understand if there were any social barriers he was facing that prevented him from self-management. It was clear that there was a lack of cultural understanding in his care, and the one-size-fits-all advice wasn't just impractical, it was alienating. And this was a wake-up call. The average rural healthcare provider is outnumbered, with the ratio being 5 primary care providers serving 10,000 residents with limited staff. So we partner with rural healthcare providers to extend their care team beyond the in-person clinical visit. Our health coach contacts patients for onboarding with first understanding what that local environment looks like with a social needs assessment, and then we equip patients with cellular devices like blood glucose monitors, blood pressure cuffs that allows nurses to track metrics remotely. Our 12-week program not only educates the patients, but also the families on things like device use, self-management, nutrition therapy, and setting meal routines for better medication adherence. This approach doubled the current standard of medication adherence, and we have an 84% participation in self-management. What's even better is our billing team helps providers bring an additional revenue stream of $600 per patient per month, with only using 1 hour of engagement from their care team. We also have over a decade of clinical care experience. So if you are a rural health provider that loves the community you serve, but are struggling to keep up with the quality demands and how you can afford to stay open, I think about the lessons learned from my father's journey. If you want to go fast, go alone. If you want to go far, go together. We are looking to onboard our first 100 rural healthcare providers, and you can use our QR code, or you can visit our website, greens.health, and that's GREENS. I look forward to going far with you.